Women dominate the healthcare industry, but new data shows they're leaving in droves across the country and here in Utah. Tamara Vaifanua joins us live with more on the fallout and what's being done to address it. Tamara, we've got to retain these nurses. What's going on?
Well, good morning, Carrie. And the numbers really aren't looking too good. According to the Bureau of Labor Statistics, in April of 2020, women lost more than 1.5 million jobs in the healthcare industry. And that's about 12% of all of the healthcare jobs held by women. And this includes physicians, nurses, as well as care workers. And researchers are pointing to the coronavirus crisis. They say many left the profession to take on childcare duties. Others are just burnt out, working long hours, dealing with patients who are critically ill and more deaths per day than they're used to. Now, here in Utah, women make up about 90% of Utah's nursing workforce. So if you take a look here, you can see that in the second quarter of 2020, turnover for Utah nurses reached an all-time high of more than 3,100, and that is 33% higher than the same quarter in 2019.
Nursing is already an inherently stressful occupation and profession, and the pandemic has essentially magnified this level of environmental stress that we work in. There's no way to take stress away from our jobs completely, but there are ways to decrease stress levels.
That really is the key. Close says that she met with the Nurses Foundation last week, and they recommended that companies institute, different programs where they can address the health and well-being of nurses. It's so crucial at this time, as well as improving access to childcare. That could go really a long way in retaining nurses as well as bringing them back. We're live in Salt Lake City. Tamara Vaifanua, Fox 13 News, Utah.